Here at GlobalRPh, we will discuss the latest treatment advances for neuropathic pain. If you haven't already, hit that subscribe button so you never miss out on our latest videos. Neuropathic pain affects approximately 7 to 10% of the global population, causing debilitating symptoms that significantly impact quality of life. This chronic condition, characterized by burning sensations, shooting pain, and hypersensitivity, often proves resistant to conventional pain medications. Recent advances in neuroscience and drug development have led to breakthrough discoveries in treatments for nerve pain. Scientists have identified new molecular targets and developed innovative therapeutic approaches, offering hope to millions of patients who have not found relief through traditional methods. These new treatments for neuropathic pain range from targeted molecular therapies to advanced drug delivery systems. We will examine the latest developments in new drugs for neuropathic pain, exploring their mechanisms of action, clinical effectiveness, and safety profiles. Viewers will learn about emerging treatment options, ongoing clinical trials, and personalized medicine approaches that promise better outcomes for patients with nerve pain conditions. The complexity of neuropathic pain mechanisms stems from fundamental changes in how the nervous system processes and transmits pain signals. Understanding these mechanisms is crucial for developing effective treatments for nerve pain. Neuropathic pain develops when lesions or diseases affect the somatosensory nervous system, either peripherally or centrally. The condition manifests through several key symptoms: spontaneous ongoing or shooting pain, heightened responses to painful stimuli, hyperalgesia, pain from normally non-painful stimuli, allodynia, and abnormal sensations, dysesthesia and paresthesia. The transmission of neuropathic pain involves complex changes at multiple levels of the nervous system. When nerve damage occurs, affected neurons develop abnormal sensitivity and pathological spontaneous activity. This process triggers molecular changes in nociceptive neurons, leading to inflammatory reactions that can induce ectopic activity in nerve fibers. Normal pain transmission differs significantly from neuropathic pain signaling. In neuropathic conditions, the central nervous system undergoes structural, functional, and chemical alterations that heighten its sensitivity to pain stimuli. These changes create a persistent state where pain signals are amplified and processed abnormally. Central sensitization represents a fundamental shift in how the nervous system processes pain signals. This process occurs when the central nervous system maintains a state of high reactivity, leading to amplified neural signaling. Studies have shown that central sensitization results in several significant changes. The condition affects 10 to 40% of patients with various rheumatic conditions, demonstrating its widespread impact. Central sensitization manifests through multiple mechanisms, including increased membrane excitability and enhanced synaptic efficacy. This recruitment leads to enhanced response to normal inputs, expanded pain receptive fields, reduced pain thresholds, and prolonged pain duration. The process involves both peripheral and central mechanisms, with changes occurring at multiple levels of the nervous system. Between 5 to 15% of the general population experiences centralized pain, highlighting the significance of understanding these mechanisms for developing new treatments for neuropathic pain. The management of neuropathic pain relies heavily on pharmacological interventions, with treatment success varying significantly among patients. Current guidelines outline a structured approach to medication selection based on efficacy data and safety profiles. The primary treatment options include 3 main drug classes. Tricyclic antidepressants, like Elavil, demonstrate significant efficacy with a number needed to treat 3.6. The recommended dosing begins low, typically less than 100 milligrams per day, due to potential cardiotoxicity risks. Serotonin norepinephrine reuptake inhibitors, particularly duloxetine and venlafaxine, represent another cornerstone of treatment. Duloxetine should be initiated at 30 milligrams daily and increased to the effective dose of 60 milligrams after 1 week. Gabapentinoids, such as pregabalin, round out the first-line options. Pregabalin shows efficacy at 300 to 600 milligrams per day in 2 divided doses. When first-line treatments prove insufficient, clinicians turn to alternative options. Topical medications, including lidocaine and capsaicin, serve as second-line treatments, particularly effective for localized neuropathic pain. Tramadol is recommended for acute neuropathic pain and intermittent exacerbations. However, its use requires careful monitoring due to potential abuse risks. The effectiveness of current treatments faces several significant challenges. Approximately 50% of patients experience adverse events with opioid medications, and more than 20% discontinue treatment due to side effects. Common limitations include incomplete pain relief even with evidence-based treatments, high rates of medication side effects, particularly at effective doses, and variable patient response to standard therapies. The challenge of achieving adequate pain control is further complicated by the fact that many patients do not respond to monotherapy. While combination therapy might offer better outcomes, evidence supporting specific combination strategies remains limited. Most patients achieve only partial relief, with current treatments providing a number needed to treat ranging from 4 to 10 for 50% pain relief. Treatment selection must carefully balance efficacy against safety concerns. For instance, while TCAs show strong efficacy, their use is limited by anticholinergic effects and potential cardiotoxicity. Similarly, while gabapentinoids demonstrate good safety profiles, they require careful dose titration and may cause significant drowsiness and dizziness. Recent advances in molecular research have identified several promising targets for new drugs for neuropathic pain, offering novel approaches beyond traditional treatments. These breakthrough discoveries focus on specific cellular mechanisms that contribute to pain. Hyperpolarization-activated cyclic nucleotide-gated channels represent a significant advancement in pain management. Studies have shown that HCN channels facilitate spontaneous ectopic firing and hyperexcitability in DRG neurons. The selective HCN channel antagonist ZD7288 has demonstrated remarkable efficacy, achieving an 86.55% reduction in current from sham neurons and 88.23% reduction in SNI neurons. Key findings about HCN channel mechanisms include increased expression of HCN2 channels contributes to neuropathic pain development. Blocking HCN2 channels reduces inflammatory factors significantly, and HCN channel inhibition shows promise in treating diabetic neuropathy. Adaptor-associated kinase 1 inhibitors represent another breakthrough in neuropathic pain treatment. BMS 986176LX9211, a notable AAK1 inhibitor, has entered clinical trials for diabetic peripheral neuropathic pain and post-herpetic neuralgia. Research has identified several innovative receptor pathways that offer new treatment possibilities. G-protein-coupled receptors have emerged as promising targets due to their widespread distribution throughout pain transmission pathways. Allosteric modulators targeting GPCRs have shown effectiveness in alleviating neuropathic pain symptoms while minimizing adverse effects. MicroRNAs have been identified as crucial regulators in pain development, influencing pain recognition proteins, neurodegenerating inflammation, and toll-like receptors in dorsal root ganglion sensory neurons. The A7 nicotinic acetylcholine receptor plays a vital role in controlling inflammatory responses, while connexin 43 expression in astrocytic glial cells presents another potential target for pain management. These pathways offer new possibilities for developing targeted treatments that could provide more effective relief with fewer side effects than traditional medications. Recent clinical trials have demonstrated that targeting these molecular pathways can lead to significant pain reduction while maintaining acceptable safety profiles. The development of these targeted therapies represents a significant advance in the treatment of neuropathic pain, potentially offering hope to patients who have not responded well to conventional treatments. Emerging pharmacological solutions. Recent developments focus on improved drug formulations and novel delivery systems that target pain more effectively. Next-generation anticonvulsants, myrogabalin, a new gabapentinoid, represents a significant advancement in neuropathic pain treatment. Clinical trials have demonstrated its superiority over placebo, with significant improvements in average daily pain scores. Modified opioid formulations. The evolution of opioid formulations addresses the limitations of traditional opioid therapy. Dextromethorphan, an NMDA antagonist, has shown promise in clinical trials, maintaining pain relief while demonstrating better safety profiles than conventional opioids. However, more extensive studies are needed to validate its use. These modifications aim to reduce addiction potential while maintaining analgesic efficacy. Innovative drug delivery system. Nanotechnology has emerged as a game-changing approach in pain medication delivers. Nanocarrier-based systems offer several advantages in drug administration and targeting. These systems can improve the therapeutic index of conventional analgesic drugs while reducing side effects. Lipid-based nanoparticles represent a particularly promising development. These carriers can increase drug solubility, enable controlled release, facilitate targeted delivery, and improve pharmacokinetics. Recent innovations include the development of polymer-coated liposomes that enhance oral bioavailability of pain medications. When modified with polyethylene glycol, these delivery systems have shown improved blood circulation times and enhanced analgesic effects. The integration of multiple drugs into single nanoformulations represents another significant advancement. This approach allows for synergistic effects and reduced administration frequency. For instance, capsaicin 8% dermal patches have demonstrated effectiveness comparable to centrally acting agents like pregabalin, with faster onset and higher treatment satisfaction. NMDA antagonists have emerged as alternative options when first-line treatments prove insufficient. Ketamine, at lower doses, acts as an NMDA receptor antagonist, while other agents like memantine and magnesium sulfate have also shown potential in neuropathic pain management. Promising drug candidates. VX-548 has emerged as a leading candidate in Phase 3 trials. The medication demonstrated significant improvement in pain reduction following abdominoplasty surgery. The recommended dosing protocol includes initial dose 100 mg, maintenance 50 mg every 12 hours. AP325, another promising candidate, has shown positive results in chronic neuropathic pain trials. The drug works by modulating GABA-A receptors, with trials expanding to multiple European countries. The Data Monitoring Committee has confirmed its favorable safety profile for long-term use in chronic conditions. The safety profiles of new medications have shown promising results. VX-548 demonstrated favorable tolerability, with most adverse events being mild to moderate. The clinical trial landscape has also revealed important insights about patient response patterns. Studies indicate that early response to treatment often predicts long-term outcomes, with significant pain reduction observed within the first few weeks of therapy. This finding has important implications for treatment protocols and patient management strategies. Personalized medicine approaches. Advances in personalized medicine are reshaping the landscape of neuropathic pain treatment, offering tailored approaches based on individual patient characteristics and response patterns. This shift toward customized therapy promises more effective outcomes for patients who haven't found relief through conventional treatments. Genetic testing applications. Genetic analysis has revealed significant associations between specific gene variants and neuropathic pain conditions. Studies have identified 28 genes significantly linked to neuropathic pain, particularly those involved in neurotransmission, immune response, and metabolism. These genetic variations can significantly influence treatment outcomes. For instance, patients with specific sodium channel gene variants have demonstrated enhanced responses to sodium channel blockers. Biomarker-based treatment, microRNAs have emerged as crucial biomarkers for neuropathic pain management. These molecules show distinctive patterns in various pain conditions, offering valuable insights for diagnosis and treatment selection. Studies have identified specific microRNA signatures in both affected tissues and circulation, with particular relevance in peripheral neuropathy and complex regional pain syndrome. The role of microRNAs extends beyond diagnosis to treatment monitoring. Research indicates that microRNA profiles can predict therapeutic intervention outcomes, serve as prognostic markers for treatment response, and guide patient stratification decisions. Patient stratification methods. Clinical stratification methods have evolved to better match patients with optimal treatments. Quantitative sensory testing, QST, has identified 3 distinct patient profiles: mechanical sensory loss with thermal alterations, thermal hyperalgesia without impaired small fiber function, and mechanical hyperalgesia with thermal sensation loss. The Neuropathic Pain Symptoms Inventory, NPSI, has proven effective in categorizing patients into specific clusters based on their sensory characteristics. In a study of 628 patients, 3 distinct clusters emerged based on pain characteristics: pinpointed pain, evoked pain, and deep pain. This classification has demonstrated practical value in predicting treatment responses, particularly with specific medications like botulinum toxin A. Better patient stratification has shown potential to enhance clinical trial outcomes significantly. This approach acknowledges that while all neuropathic pain states result from somatosensory nervous system damage, the underlying pathophysiological mechanisms may differ substantially between patients, necessitating individualized treatment approaches. Safety and efficacy considerations. The evaluation of safety and efficacy in new treatments for neuropathic pain requires careful consideration of long-term outcomes and potential risks. Recent studies have highlighted the importance of comprehensive assessment frameworks to ensure optimal patient outcomes. Treatment success varies significantly among different patient groups. Studies show that only about 25% of patients achieve improved pain and function at 12-month follow-up. This relatively low success rate underscores the importance of regular monitoring of treatment response, dose adjustments based on individual tolerance, and consideration of alternative therapies when needed. Long-term safety data. Long-term safety studies spanning 52 weeks have provided valuable insights into the durability of treatment effects. For mirogabalin, a newer medication for neuropathic pain, flexible dosing, start with 5 mg twice daily and gradually increase after 1 week to 10 or 15 mg twice daily. The safety profile remained consistent with shorter-term trials, suggesting stable long-term tolerability. Monitoring requirements for different medications vary significantly. For tricyclic antidepressants, ECG monitoring is essential due to potential cardiac effects. The recommended approach includes baseline cardiac evaluation, regular blood level monitoring, periodic assessment of anticholinergic effects, and evaluation of cognitive function. Adverse effect profiles. The most frequently reported adverse effects across new treatments for neuropathic pain include somnolence in 15.2% of patients, peripheral edema in 9%, dizziness in 7.1%, weight gain in 5.2%, and edema in 3.8%. Serious adverse events remain relatively uncommon, occurring in 13.3% of patients during long-term studies. However, treatment discontinuation due to adverse effects affects approximately 11.4% of patients. These rates vary among different drug classes and individual medications. Gabapentinoids and newer agents like mirogabalin demonstrate better tolerability compared to traditional treatments. The incidence of adverse reactions was notably lower in certain patient groups, such as those with central neuropathic pain after spinal cord injury, at 24.5%. For optimal safety management, clinicians should consider that drug-related adverse effects are particularly common in neuropathic pain treatment. This higher incidence is attributed to the older age of many patients, concurrent medications, and the presence of comorbid conditions. Recent studies indicate that benefits of pharmacotherapy for improving quality of life, including physical and emotional function, have been less consistent than pain intensity reduction. Most randomized controlled trials focus primarily on diabetic peripheral neuropathy and post-herpetic neuralgia, limiting broader applicability. Treatment monitoring should include regular assessment of cognitive effects, as many patients report brain fog, including drowsiness, difficulty focusing, and short-term memory issues. The balance between efficacy and side effects requires individualization, with careful attention to patient-specific factors and comorbidities. Future treatment directions. The development of innovative treatments for neuropathic pain continues to advance, with researchers exploring novel molecular targets and delivery systems that promise enhanced therapeutic outcomes. Recent breakthroughs in drug development and combination approaches are reshaping the treatment landscape for patients with nerve pain conditions. Pipeline medications. BP4L1811, a groundbreaking non-opioid molecule, has demonstrated remarkable efficacy in preclinical studies for treating chronic neuropathic pain. Sabirnopidol, a dual NMR agonist, has undergone extensive testing in more than 30 clinical trials involving approximately 2,000 patients. Combination therapy. The treatment landscape is shifting toward combination approaches, as monotherapy proves effective in less than 50% of patients. Clinical evidence supports several combination strategies. A gabapentinoid such as pregabalin with TCAs. This combination shows the strongest documentation and clinical experience. Pregabalin or gabapentin with SNRIs demonstrates good efficacy with fewer side effects than high-dose monotherapy. Cutaneous patches with oral therapies, effective for patients suitable for local treatment. The rationale for combination therapy rests on two key principles. Phenotypic profile-guided treatment improves symptomatic control. Targeting multiple pain mechanisms simultaneously may allow lower doses of individual drugs. Research priorities. Future research directions focus on several key areas that promise to advance neuropathic pain treatment. Innovative approaches under investigation include non-pharmacological integration, neurostimulation techniques for pain control, remote electrical neuromodulation, transcranial magnetic stimulation, novel delivery systems. The development of molecular bathysphere technology represents a significant advancement, allowing for peripheral nerve cell targeting, reduced central nervous system effects, enhanced drug delivery precision, emerging technologies. Research priorities increasingly incorporate virtual reality applications, wearable technology integration, and artificial intelligence-based treatment optimization. The field continues to evolve with the exploration of psychedelic compounds for treating resistant cases. Preliminary studies indicate potential effectiveness for conditions like fibromyalgia and neuropathic pain. This represents a significant shift in research focus, complementing traditional pharmacological approaches. Researchers emphasize the need for improved clinical trial designs that can better evaluate combination therapies. Current evidence suggests that combining drugs with different mechanisms of action may provide superior outcomes compared to monotherapy. However, the identification of optimal drug combinations requires additional rigorous evaluation through well-designed studies. The integration of pharmacological and non-pharmacological approaches remains a key research priority. Studies indicate that neurostimulation techniques can effectively control pain in specific patient populations, such as those with paraplegia and above-knee amputation. These findings suggest a potential shift from purely palliative treatment to disease-modifying interventions. Conclusion. Neuropathic pain treatment has entered a new era marked by significant therapeutic advances and targeted molecular approaches. Research breakthroughs have identified promising targets like HCN channels, ABLK1 inhibitors, and novel receptor pathways, expanding treatment options beyond traditional medications. Clinical evidence supports several effective treatment protocols. Mirogabalin shows optimal results at 15 to 30 milligram daily doses, while VX548 demonstrates pain reduction at a 100 milligram initial dose followed by 50 milligram maintenance doses every 12 hours. Dextromethorphan proves effective at 90 milligrams daily for resistant cases. Personalized medicine approaches through genetic testing and biomarker analysis now enable more precise treatment selection. Patient stratification methods have revealed distinct sensory profiles, allowing clinicians to tailor interventions based on individual characteristics. These advances, combined with innovative drug delivery systems and combination therapy strategies, offer renewed hope for patients who have not responded to conventional treatments. Safety profiles of newer medications show improvements over traditional options, with most adverse events remaining mild to moderate. Long-term studies spanning 52 weeks demonstrate sustained efficacy and tolerability, particularly for newer agents like mirogabalin and selective sodium channel blockers. Research continues to advance through pipeline medications, combination approaches, and novel delivery systems. These developments, alongside emerging technologies and non-pharmacological interventions, promise enhanced therapeutic outcomes for the millions affected by neuropathic pain conditions worldwide. Thank you for watching our GlobalRPh production. If you found it enjoyable and informative, please consider liking the video and subscribing to our brand new YouTube channel. Our content spans a wide range of topics designed to appeal to a diverse audience, ensuring there's always something fresh and engaging for everyone. Your support helps us grow and continue to provide interesting and valuable content. Stay tuned for more exciting videos.